I'm Dr. Ryan Sunderman, Unity Point Health, St. Luke's Hospital ER Medical Director. As the world deals with COVID-19, we want you to know St. Luke's is prepared and working with our corridor hospital partners to care for our communities. Here are the symptoms of COVID-19: fever, cough, shortness of breath. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. However, this list is not all-inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. These symptoms may appear 2 to 14 days after exposure. Call your doctor if you have concerning symptoms to determine next steps. And if you do need emergency care, please call ahead to the ER and tell them why you are coming so we can arrange to meet you and direct you to the right location. If you need an ambulance, be sure to tell them when you call about your symptoms so paramedics can take the correct precautions. This is Dr. Ryan Sunderman with Unity Point Health, St. Luke's ER.
This is LiveWell Talk on alcohol. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Alcohol is a significant part of our culture, from a glass of champagne and a toast to grabbing a beer with friends after work. It can be very positive in social settings, but for some people, when consumed in excess, can lead to a disability and disease. To discuss this today with me is Matt Rocca, Program Manager at St. Luke's Chemical Dependency, and Mary Beth Peiffer, Oncology Dietitian at Helen G. Nassif Community Cancer Center. Welcome.
Glad to be here.
Thank you.
I mean, alcohol is a big part of our culture. Going back to antiquity, I mean, this is nothing that's new. And it's there. We tried as a society to prohibit it. That didn't work out very well. And so we need to be aware of the risk and the benefits. Alcohol, obviously there's the dependency. Some people can drink and not have any problems, and moderation is not a big deal. Others aren't as fortunate and can lead to a significant disability. I'd like to cover both the disability from that as well as some of the nutritional aspects of it and some of the other comorbid conditions that we see with alcohol. Now, I'll kind of start with you. What is moderation when it comes to alcohol consumption?
Sure. Moderation is a concept that we hear about, and as you identified, there's certainly individuals that are more capable, maybe don't have a family history or a background of addiction, and are able to consume alcohol in smaller amounts where there isn't any problems. Certainly by the time they get to walking in the door in an office like ours, something has happened. So those are the individuals that we certainly give a little bit more attention to and try to figure out and understand and help, are the ones that it's gone beyond being able to demonstrate to themselves and to family members that it's not causing problems. It's very common for individuals to really get focused on amounts, whereas we try to focus on problems. So the amounts really can vary for some people for what can work, but once those problems do start to show up, that's where we're hoping we might be able to make some contact with them.
In that same line, Mary Beth, let's say I'm consuming alcohol in excess or moderation, quotation marks, but I'm not having problems. I don't have any disruption in my life. But what's considered moderation from a dietary standpoint?
Well, from dietary standpoint, moderation for recommendations from the American Cancer Society are 2 drinks a day for men and 1 for women. And a 12-ounce beer is considered 1 serving. A 1.5 ounce alcohol shot, I guess you would call it, is equivalent to 1 serving. And wine, it's about 5 ounces, is considered a serving. And kind of where we see nutritional problems is those calories that people get from alcohol replace something else nutritionally that they really need, like protein or a variety of other nutrients. So the risk for malnutrition is pretty high for those people that do drink in excess.
And that's where we get the term empty calories, that there's really no nutritional benefit. It's funny you say the once a day, 1 drink a day. I've seen many patients over the years, and, you'll say, how much do you drink? I have 1 drink a day. Okay. Well, then during my residency, Tanya and I lived in this building with all these retired women, and we would meet them Sunday afternoons in someone's apartment for beverages, and they would have a tumbler that was 16 ounces, and I was just thinking to myself all the time, yeah, I bet they tell their doctor, I have 1 a day, and so it's good to put that quantitate, that amount on there and understand that, 5 ounces is not a lot.
No, it's not. And the supersized containers that alcohol comes in these days, I don't even know all the names for some of them that can it be equivalent to 7 to 11 drinks?
Yeah.
So it's, I think it was the boxes of wine that go in the refrigerator. It's 33 servings
Wow.
of the 5 ounces. And I thought, wow, and I think awareness is the first step in understanding, that alcohol, for some people, moderation works, but for other people, and what we're finding with cancer prevention, that there's a definite link, even for occasional alcohol use, increasing cancer risk in 7 different types of cancer, primarily the digestive system from the head down to the colon, and with women, breast cancer.
Now, is there that a difference between hard alcohol, liquor, as opposed to beer, or is it the risk of all?
It's the amount of alcohol
Okay.
per drink, and I think it's 10 milliliters of alcohol is considered an average drink. So that's what all 3 of those things I mentioned earlier
Sure.
have in terms of alcohol content.
Matt, do you see at Chemical Dependency, do you see a lot of people with health problems from alcohol? I don't know if my patient sampling is biased, because the ones that are in the hospital obviously have liver problems and
Sure.
concerns. So to me, I think every person that has that problem. But what do you see?
Yeah, so absolutely. The health problems we'll see will be not only mental health issues that we deal with, but the physical health issues a lot of times really do center on nutritional habits. So even with our moderate to severe cases in the outpatient setting, the nutritional choices and decisions that they make lessen or worsen, that we'll see that commonly with alcohol. Then the more severe cases, the ones that we are coming up to see the hospital in, they've gotten to the point where, as you're familiar with, they're replacing their meals with alcohol
Right.
over long periods of time. So if you're doing that, as you know, for 2 weeks or 2 months, now we're talking about the body needs nutrients and fluids to rehydrate, and that gets real serious, because that's those are admissions where we're coming up, and
they
those are
definitely
very serious. So we see them kind of at 2 different levels with the relationship that the negative influence that alcohol can have on nutrition. An outpatient setting, still serious, but even more so in those inpatient patients we see.
Mhm.
And do you see the age of people drinking more now than they perhaps in the past in your specialties?
I mean, I know that like the state of Iowa certainly collects that kind of data. For the patients that we see, we serve, adults only, but we know that there's some data out there that certainly supports that, not only with other substances, but with alcohol, and that there's more kids that are experimenting. There's more kids that, are coming to that conclusion that, it's less risky than maybe it used to be, or what I was told. So I would think that there's probably some good data out there that supports there's a little more going on.
Much like vaping, I just don't
Yeah.
think it's a good idea to push these flavored seltzer, alcoholic beverages, and flavored beers, et cetera, because you're just making it more palatable to perhaps to younger people.
Absolutely.
Is there an age where I should quit drinking alcohol? I mean, do you recommend that later in life, Mary Beth, as part of to stimulate appetite, et cetera, in cancer patients?
Yeah. When I was working in long-term care, and we had older geriatric patients that had a problem with appetite, we sometimes did allow that. And one of the requests that we got for recreation was a happy hour before the meals because of that. However, now that I'm working in oncology, I see that really any alcohol is probably not in the best interest of patients that are trying to prevent any significant disease, particularly cancer.
So, and falls in the elderly, I imagine, if you, because alcohol obviously impairs your balance. How long does it stay in your system, Matt? Do you know?
Well, and there's a lot of variables that can impact that, with the length of time. The law enforcement community really has to spend a lot of time, effort, and energy trying to figure that sort of stuff out. But, certainly we're talking about male versus female. The same amounts, are going to be metabolized differently and processed differently, on a full stomach, on an empty stomach. So there's a number of different things that can influence that. But so the average length, I really couldn't tell you unless we're looking at a real specific situation.
And I'm sure it's variable on people's metabolism, the amount of formic acid they can make, et cetera, alcohol dehydrogenase or whatever it is that processes that in the liver. You mentioned the cancers, breast and gastrointestinal. What are some, you mentioned 7, what are some other ones that people should be wary of?
Obviously the liver cancer, which is where our body processes alcohol. Any tissue in the body that is physically exposed to alcohol, and that's where I mentioned the head and neck. So mouth, we have a lot of head and neck cancers. When I first started in oncology, we had about 5 head and neck patients at one time. We have 35 now. And head and neck cancer is probably one of the worst cancers to have due to the treatment effects. And the good thing is it's very curable, but the bad thing is it's a tough treatment.
Yeah, definitely.
So it's liver, breast, I think I mentioned earlier, but colon, particularly in men, they're finding a higher relationship. And when we were talking about alcohol and nutrition, Matt was talking about, the variability, and men metabolize it more quickly than women due to the amount of muscle mass versus fat. Where women have more fat, it doesn't process it as quickly or efficiently. So for women, like I said, the breast cancer, colon cancer is another one that we try to do our best to prevent. But the American Institute for Cancer Research recommends no alcohol at all, even small amounts. And that's a change from previous recommendations.
Right. Because then you get in from the American Heart Association. Then
there's a little bit of a
if you red wine, and then which they've actually found out it's probably the red grape, which the Welch's people are obviously excited about. So it's actually they think it might be a tannin in the grape skin, and that's what the benefit is, and it's not actually wine. But then people take that to drink the whole box of wine, thinking they've just got extra health prevention, and that's not the case. It's about liver cancer. That's kind of the classic internal medicine case that it's the alcoholic that survived their alcoholism, has been sober for 20 years, really, and then they present with liver cancer later in life. That's one that we've seen, and you always think about that when an recovered alcoholic or recovering alcoholic presents with a health problem later in life. Matt, back to the clientele that you and I deal with on this end of the spectrum, or that end of the spectrum. I always say when an alcoholic shows up for medical care, look for something beyond their alcoholism, because they wouldn't be there unless something was driving them there.
Right.
So look for the pneumonia, look for the something else that might be going on. That don't just attribute it to their intoxication.
Yeah.
I think you have to be vigilant on
They can
that.
be very complex cases with a lot going on.
You bet.
Yeah.
We talked about the elderly population or preventing stuff. Matt, what's some underage drinking? That obviously doesn't sound like a good idea. So what are some problems that you see with that?
Well, certainly anybody that presents to us with what we define as early onset is unfortunately a real indicator of there's probably going to be problems down the road. So we're talking with, we have an opportunity to speak with parents or with younger patients we'll see at the hospital. The longer that you can hold off on having any alcohol, the significantly greater chances you are to not have any problems at all with alcohol down the road in your life. So there's some good data out there that really supports that also. But then also, that no different than we've talked about with any substance and some other substances specifically is, when you're using them in that window of time where you're growing and maturing and developing the most, that is the riskiest time to be learning how to cope with issues by using substances, what it can impact on you even physically, which you know much better than I would, but that social component on using it as a coping skill when your mind and body are growing and developing the most during that 5-6 year window of time as an older teen, a young adult. That's where we really see the risks, and the problems start to show up, and they can be prolonged, over life with the earlier that you start, which is kind of common knowledge.
My dad, who long passed away, but was a heavy drinker, he always would say, the bottle will not provide answers, but it makes the questions go away. Mm-hmm. And, that's so true that it really doesn't solve anything. It just delays the consequences of whatever is going on in your life.
Absolutely.
Mary Beth, back to you from a nutritional standpoint or risk standpoint. Beer, wine, liquor, they're all risky. There's not a safe alcohol beverage.
Yeah. Matt and I were talking a few minutes before we started about smoking and the impact of what a dangerous duo alcohol and smoking are. And this is what we found in our work with cancer patients, is that if they've got both of those things going on, your cancer risk increases almost 7-fold by doing both of those things. So it's a pretty dramatic, and like I said, I call it a dangerous duo. So, and we do have patients that totally quit drinking alcohol upon a cancer diagnosis. They are encouraged to totally cease smoking and alcohol consumption, and many do. And we of course always give them positive feedback that, what a wonderful thing that is. But there are some people that the social aspects are so strong that their desire to stop is overwhelmed by
Well, that's a good
bodies.
point to come back, Matt, with. I mean, we use the term recovering alcoholic. And I think not from necessarily that maybe someone that's a recovering alcoholic listening, but maybe people that might interact with them, that they should know that there's really not a safe amount of alcohol for that person to consume. That, they're just going to be a glass of champagne at this toast, or et cetera, that they really should avoid that. And if they're a good friend, they'll take that into consideration prior to expose them, right? I mean, you can't
Absolutely.
just...
Yep. The risks of having one drink for the alcoholic, are tremendous compared to maybe the person sitting next to them that does not have that history at all, or even a family history of it, and can have that one drink and it totally they react to it differently. The common metaphor we use a lot of times is, if you have an allergy to a bee sting, when you're little, but you don't have a bee sting for 20 years.
You're still allergic.
If you still have a bee sting 20 years down, you might have a reaction to that bee sting, which is similar to what we'll see with people with alcohol.
That's a great analogy.
Yeah.
That really is. If we could give one, I'll let each of you, and we'll start with Mary Beth. If you could give one thing that you could give advice to people about alcohol and what you see cancer and dietary, what would you tell them?
Well, I really have to say and encourage people not to drink at all, if at all possible, and look for non-alcoholic substitutions. Things like Crystal Light, teas, particularly green tea, we know has a cancer-fighting effect compared to even black tea. But looking for things that don't have the negative effects that come with alcohol. And that's why many groups' recommendations is no alcohol at all, if possible. And with patients that come in often have B vitamin deficiencies. As you know, we do give them thiamine because we need to get that alcohol broken down. But we see malnutrition quite often if we have people that have been long-term drinkers and consistently drink.
Yeah, severe malnutrition. A couple of years ago, it's been longer than that, I had a lady present with Wernicke's, Korsakoff, with vitamin B deficiency, to the point that, she's still impaired, but has recovered, but still has disability from that, which is unfortunate because it's so preventable. A bowl of breakfast cereal is going to replace most of those vitamins.
Yep.
Matt, how about it? What advice would you give individuals regarding alcohol consumption?
Yep, we would say, our message is always very clear. Nothing compares with the problems that alcohol has caused in our society, whether you're looking at dollar amounts or health issues like we're talking about today. A lot of times what people identify for the right reasons, maybe if you want to look at tobacco and the problems that has caused. But for us, our message has always been, if the health issues, the health problems that can be very situational or long-term, associated with developing a relationship with alcohol and using it, can be very severe. So we would encourage people to really think about that.
And if they do have trouble with that relationship, it's not a positive relationship, they should seek help, shouldn't they?
Absolutely. We would say for a community our size, there's some great treatment options. Certainly we would say stop by and see us, have a conversation, talk with a counselor, and we could start that process with trying to determine, how severe is the situation. And there's a number of different kind of levels of severity, but we can help them walk through that.
Yeah, absolutely. Why wait till rock bottom to get help?
Right, absolutely.
Recognize, you have a problem, and listen to your loved one.
Absolutely.
That might be encouraging.
Sooner the better, absolutely.
Yeah. Well, this is really great information. Thanks so much for taking the time to talk about this. Again, that was Matt Rocca, Program Manager at St. Luke's Chemical Dependency, and Mary Beth Peiffer, Oncology Dietitian at the Helen G. Nassif Community Cancer Center. If you have a topic you'd like to suggest for our Talk On podcast, shoot us an email at stlukescr@unitypoint.org. We encourage you to tell your family, friends, neighbors, strangers about our podcast. Until next time, be well.